Good morning, everyone. Good morning to our media partners and good morning to our experts on COVID-19 variants for joining us today in this special briefing to update the public on the COVID-19 variants and the interventions that we have been putting in place to ensure that um, we are able to manage the variants in the Philippines. With that, I give you the Undersecretary Maria Rosario Singh Vergere, our official spokesperson. Yusek.
Yes, good morning Laura and magandang umaga po sa inyo lahat. Welcome to our special presser coming from the DOH. So gusto lang ho namin i-recognize muna all of the members of the IATF Task Force on COVID-19 variants are here. We have Dr. Eva Maria Cutionco de la Paz. We have Dr. Edsel Salvania, Dr. John Wong. We have Dr. Celia Carlos, Dr. Jimmy Montoya. We have Dr. Ana Ong Lim, Dr. Isa Alejandria. And of course, we have Dr. Cynthia Saloma. So kasunod po ng sinasagawa nating purposive genomic sequencing ng University of the Philippines, Philippine Genome Center at ang UP National Institutes of Health sa mga inbound travelers na dumating sa bansa noong Abril na may history ng travel sa India na may reported na B.1.617 variant na unang nai-report doon sa bansang iyon. Nais po naming ipaalam sa publiko na tayo po ay may natukoy na 2 kaso na may nasabing variant. Sa pamamagitan ng mga pinaigting na genomic surveillance na patuloy na sinasagawa ng UP-PGC at UP-NIH, ay nadedetect at namomonitor po natin ang mga nasabing variants of concern at saka variants under investigation. Dahil po sa masusing pag-aaral, ang mga datos tukol sa mga variants na ito, nagagawa nating magpatupad ng mga angkop na strategies upang maiwasan ang anumang di mabuting epekto ng mga variants. Patuloy po ang panawagan ng Kagawaran ng Kalusugan sa pagsasagawa ng stricter border control measures upang mapigilan ang local transmission ng variants na ito. Tayo po ay kasalukuyan nagpapatupad ng travel ban sa lahat ng mga papasok sa Pilipinas na nanggaling sa mga sumusunod na bansa. Galing sa India, sa Pakistan, sa Nepal, sa Bangladesh at sa Sri Lanka. Atin din pong ipinapatupad ang ilang pagbabago sa ating protocols for all inbound travelers. Ang lahat ng papasok sa ating bansa via any port of entry at anuman ang kanilang vaccination status ay sasailalim sa mandatory 14-day quarantine sa kanilang pagdating. Ang unang 10 araw ng quarantine ay gagawin sa quarantine facilities habang ang natitirang 4 na araw ay dapat siguraduhing makumpleto under home quarantine in the respective local government units. Gagawin po ang RT-PCR test sa ika-7 araw mula sa kanilang pagdating. Ano man po ang maging resulta ng RT-PCR, kailangang kumpletohin ang 10 araw na quarantine sa loob ng quarantine facilities. Kasabay po ng ating pagpapatupad ng stringent border control measures at maigting na pagpapatupad ng PDITR response strategies hanggang sa ating mga lokal na komunidad, walang sawa po ang aming panawagan sa publiko. Sundin po natin ang minimum public health standards upang maprotektahan po ang ating mga sarili at maiwasan po natin ang pagkalat ng nasabing variants. Ngayon po ibibigay ko sa inyo si Director Thea de Guzman ng aming COVID-19 Surveillance and Quick Action Unit para magbigay po ng kabuuang detalye nitong na-detect natin ng mga variants na ito. Director Thea?
Thank you for Yusek. Good morning everyone and to those who are tuned in. We'd like to provide some bioinformation. This will include yung lahat ng na-sample na-sequence na po nating samples as well as the information just given po by our Undersecretary. I'd like to start off that of the 5,952 samples where we have a lineage, no? Sabihin, may na-sequence po sa kanila, a total of 34% of these samples are positive for a variant of concern. And this includes the B.1.1.7, the B.1.351, and the P.1. Currently, there are already 12 regions where we have local cases positive for the B.1.1.7 or the one first detected in UK, 15 with the B.1.351 variant, the one detected from South Africa, while we have 2 P.1 variant cases. These were only among incoming international travelers. And currently, these incoming international travelers comprise 299 or 18% of all the cases positive for at least a variant of concern. And in the latest sequencing done, where we sequenced were 46 samples, we were able to detect two cases positive for the B.1.617.2 variant, or the one from India. There were also 23 samples positive for the B.1.351 and 4 for the B.1.1.7. I'll go on now to provide the case details for these two cases po. So before that, let's have a short overview, no. Ano ba tong pinag-uusapan natin na B.1.617 na variant? This was a variant first detected in India last October 2020 when they submitted samples to GIS-8 po. Currently, based sa GIS-8 database natin, there are also 46 other countries where this variant has been detected. This contains at least 15 mutations, and there are two significant mutations of significance na binabantayan po natin. At ito po yung L452R and the E484Q. And the specific variant, the B.1.617.2, which we detected, has an additional mutation, which is the T478K. So, quickly lang po, the L452R mutation has been associated with increased transmissibility, meaning mas dumataas yung posibilidad na mas mabilis siyang matransmit from one person to another, as well as what we call the reduced antibody neutralization po. Meaning, pwede po na ma-evade ng virus yung mga antibodies nito among those who have recovered or yung pong mga vaccinated na individuals. This mutation is also present in the variant found to be the predominant variant in California, yung B.1.427 and the B.1.429. The other significant mutation found in this variant is the E484Q, which is similar to the E484K found in the B.1.351 and the P1 variants. At ang kanilang potential clinical significance is mas kumakapit po sila dun sa ACE2 receptor, meaning pwede siyang mag-escape, no, dun sa mga antibodies. So we call it immune escape po. But we have to emphasize that we need to gather additional evidence. Further studies have to be conducted so that we can verify, we can better understand the impact of these mutations and this variant as to transmissibility, infectivity, and as well as its effect on our vaccine efficacy. So, go on to describe yung dalawa pong kaso natin positive for this variant. The first is a 37-year-old male who is a sea-based overseas Filipino worker, currently already in Region 12. He came from Oman and arrived in the Philippines last April 10, and as per our protocol, a sample was collected last April 15 and turned out to be positive on PCR. He has been isolated in a hotel upon arrival, transferred to another isolation hotel after testing positive on PCR, and was tagged as recovered and released from isolation last April 26. He was conducted back to Region 12, and upon arrival, as per the LGU protocol, he underwent another 14-day quarantine. They also conducted a repeat PCR test, which was already negative last May 3. Our case is pretty well and remained asymptomatic. Our second case is a 58-year-old male, also a sea-based overseas Filipino worker, now in Region 5. He arrived from United Arab Emirates last April 19 and was swabbed last April 24. He has been isolated in a TTMF in Clark, was tagged and discharged last May 6. He was also conducted by OWA back to his municipality and remains to be asymptomatic as of this day. So that's the details for our two cases, but we'd like to end with these three key messages. we'd like to emphasize that ito pong ginagawa nating biosurveillance, ito po ay kombinasyon ng paggamit ng ating epidemiology and surveillance data. And it is complemented by the data we get from our whole genome sequencing. And as one, they are used to guide our ongoing response policies and strategies. Also, because of our ongoing biosurveillance efforts, we have been able to detect these variants of interest and concern among our incoming travelers. And this data further supports the emphasis we have put on the need for strong border control, as well as the completion, correct quarantine and isolation of our incoming international travelers. And the last message I'd like to put across is that we need to continually monitor what other variants we may be able to detect locally, as well as monitor the spread of the variants we have already detected so that we can better guide the ongoing implementation of our PDITR strategies. So with that, Yusek, thank you very much. I'll turn it over back.
Laura?
Thank you, Yusek. I'll begin first with the clarification by our media partners with regard to the case, no? So they're asking if tama ba that the two cases we've detected with the variant first detected in India, they have a travel history from India, and what are the status, ano yung status nila ngayon? At di na ba sila infectious? At I think yon, ano na rin ang status ng close contacts nila? So either Yusek Reset or Director Thea for that, please.
So I think Director Thea can give us the details as to the status of these two individuals. And maybe our tag experts can give us their input on the question if they are still infectious or not. Thea.
Thank you, Yusek. So, yung ating dalawang kaso po have already been tagged as recovered. And as mentioned, they're already currently asymptomatic, no? It's been more than 2 weeks for one, and then almost a month mula po ng unang arrival po ng isang kaso natin. At yung nga pong unang kasong nabanggit natin na nasa Region 12 na po ay nag-test negative na po on their repeat PCR. Thank you po, Yusek.
Doc Thea, what about their close contacts?
Dahil ang ating mga kaso naman, no, pagdating ay nailagay na sa quarantine, no, at tapos nalipat nga po sa isang isolation facility mula na mag-test positive, wala po tayo na-detect ng close contacts dahil naiwan na nga po silang naka-quarantine and then isolation. And when released, they were already asymptomatic and already tagged as recovered.
Final clarification, they have a travel history from India.
As of now, this is the information we got from these two seafarers is they had no travel history from India.
Okay po. Maybe from Dr. Edsel, are these two cases still infectious po?
Yeah, well, thanks, Laura. At this time, actually, there's no evidence naman that the variants from India are more or less infectious than the other variants. There is some evidence that suggests that mas infectious sila, pero yung duration of infectiousness, there's no evidence that it lasts longer than with the other variants. So right now, based on what we know, our protocols should still be good in terms of determining whether they're non-infectious. Most of the time, by the 8th day of illness, hindi na nagsished ng infectious virus yung mga patients, and in this case nga, there's an RT-PCR na nag-negative already. So when they're tagged as recovered, they're no longer considered infectious.
Thank you, Dr. Edsel. Would any of our experts like to add to that, or can I move on to the next question? So I'll move on to the next question. No, so we have been detecting more VOCs or variants of concerns and variants under investigations or variants of interest. No, why is the case that we're detecting more VOCs and VUIs? And are these VOCs and VUIs dominant variant in the country? Can Dr. Eva or Dr. Saloma answer po?
Hello, Hello, Laura. I think that question can best be answered by the Epidemiology Bureau. So I would like to ask the EB to answer that question. Thank you.
Thank you, Director Thea.
Okay. Thank you. So, una, we term it as the most common variant. We'd like to explain na yung pamamaraan natin, paano natin pinipili kasi yung sample. We call it, it's disproportionate right now. Hindi siya distributed na equally among our region. So, sa ngayon, pinakamarami talagang samples na nakukuha natin ay una sa largest regions, which are NCR and Calabarzon. And because we have already detected variants of concern in these areas, the more we get samples from these regions, mas mataas po talaga yung likelihood na yung makukuha nating sample at masisequence natin ay mga magpopositibo for a variant of concern. Ikalawa, yung isang goal kasi ng ating biosurveillance is kapag meron tayong nakitang spikes in cases or meron tayong nakitang case clustering, pina-prioritize natin sila for sequencing para malaman natin na meron bang variant of interest or concern dito. Kaya doon din tumataas yung likelihood na yung mga nakukuha nating samples ay mga positibo rin for a variant of concern. Kaya kaya dumadami po talaga sa bawat sequencing yung mga nagpo-positibo natin para sa mga variants of concern or variants of interest na ito. Baka kanina I saw Dr. Eva also wanted to respond. Thank you, Laura.
Thank you. Dr. Eva?
Yes, Ms. Laura. On a general basis, sa konteksto ng mga viruses, alam natin pag maraming kaso, ang viruses ay magmutate. So, kung maraming kaso sa ating paligid, malaki rin ang tsansa ng mga virus mag-mutate. Kaya maari ding ito ang dahilan kaya mas marami tayo napipick up na mga variants of concern tsaka yung mga variants of, hindi na variants of concern, pero yung mga variants of interest natin din ay napipick up natin dahil nga pinag-iigting na rin natin ang ating surveillance system. Ayun lang ang idadagdag ko, Ms. Laura.
So Laura, dugtungan ko lang, Laura, yung sinabi ni Dr. Thea na so sinasabi naman din ni Dr. Thea na yung ating sampling, syempre purposive and usually kung saan po yung may spikes of cases, doon po tayo nagsasample. And very important po yung ating technique, the technology for whole genome sequencing. Mas gusto talaga na yung mga mabababa ang city value, ibig sabihin marami tayong target na makikita. So yung ating mga variants of concern kasi usually ang mga city values nila bababa. So kung magbigay sa atin ng mga samples yung mga laboratories, pinipili din naman nila yung mga samples na mababa yung city value because that also gives us a higher probability of doing the assembly of the whole genome. Kaya siguro nakadagdag din yon sa bakit ang dami na nating mga nakikitang mga VOCs at saka sa ating sampling run. Yun lang po.
Thank you po, Dr. Cynthia. So, nakakakita tayo ng variants because we are purposively looking for them, no? On that note, I'd like to ask Dr. John Wong po, can you refresh us po, ano po ba talaga yung purpose ng genomic surveillance? And ano yung implication of the data that we get from our genomic surveillance as it relates to interventions po natin, both at the population and individual level po? Doc?
Thank you, Laura. So in doing genomic surveillance, we're trying to answer several questions. First is, do we have a variance problem? No? Meaning, is the variant present in the country? So since January, we've established that, and as new VOCs appear, we're able to detect them as they enter the country. Second, we try to determine the magnitude of these variants. What is the prevalence? Is it high or low? And as time goes by, is it increasing? Or is it stable? Because our control measures have started to work. Then third, we're also trying to characterize the patients who have these variants, in terms of what are their socio-demographic or clinical characteristics, where are they from, when were they infected, no? So that we get a better not just epidemiological but also clinical picture, no? So, for example, for B117 in UK, they saw that younger people were more likely affected, no? Pero we haven't seen that pattern here in the Philippines. And with all that information, it helps us design our public health programs, no? To see whether we need to change anything, no? To minimize the spread of the variants. Thank you.
Thank you po. Doc Edsel, would you like to add po?
Yeah, I mean the idea of genomic surveillance is really to give us an idea what variants are circulating, and because this is a sampling thing, it's very difficult to extrapolate, especially when we're talking about purposive sampling. But it is very useful data. Why? Because we know that these variants of concern are linked to increasing transmission rates and everything. So we can better prepare from a policy standpoint, from itong ginagawa nga natin na mas pinapaigting pa natin na quarantine, kasi very clear naman paano ba nakakapasok itong mga variants na to? It's really from people coming from the outside. And so when we see more variants being transmitted in the community, it means may nakakalusot pa talaga dun sa ating ginagawa. And that's why we have to tighten up. So very, very important that we have an idea, and also how fast these are coming and which countries siguro na mas kailangan natin mag-ingat.
Salamat po. Next question po, maybe for Dr. Ana or Dr. Isa. May pagbabago po ba sa clinical management natin ngayon na may variants tayo? And pangalawa, nalalaman ba ng pasyente na they are carriers of either a VOC or a VUI? Dr. Isa?
Thank you, Laura. Good morning. Yung second question muna, if the patient knows that they're carrying the variant of concern. At the outset, hindi agad yon kasi ang testing natin is PCR, and then kailangan ng sequencing para malaman kung variant yung virus na naka-infect sa pasyente. So, kaya yun yung purpose ng genomic sequencing, to tell us if the patient has the variant or not. Now, whether it has a direct implication or impact on the management, wala. No? Kasi pagdating ng pasyente, minamanage na namin siya as COVID. No? Not because, as I mentioned, yung RT-PCR naman will not tell us na variant yun. So pareho pa rin po ang management ng pasyente natin, parehong isolation procedures, parehong mga gamot ang binibigay natin sa pasyente. Thank you.
Salamat po. Dr. Ana, would you like to add po?
Laura, siguro yung kaling na-identify buting to, may impact ba dun sa kanyang clinical course, sa presentation, sa diagnosis? And based on what Dr. Isa shared, di ba, actually nalalaman na lang natin the positive cases identified. We manage them as per the usual protocol at wala naman silang mga nagiging issues. So siguro yung pwedeng makuhang assurance ng public is that sa ngayon, sa nakikita natin sa behavior ng variants, they still behave as if they were any other form of COVID. Pero kaya natin pinag-iingatan and iniiwasan natin yung pagpasok nito sa Pilipinas is because yun ngang implications in terms of transmissibility and spread. Thank you.
Thank you po, Dr. Ana. So very clear, no, from Dr. Ana and Dr. Isa on the potential increased transmissibility of our VOC. No change in our case management or in our protocol, no, PDITR and the MPHS, and plus the vaccine remain to be effective po dito. For the increased severity, it's the same case management. They're managed as COVID patients, and it actually increased our capacity na rin to manage critical cases. Yung next question po, may clarification lang, Doc Thea or Director Saloma. Yung sequencing po ba nung 5 samples, yung original po na 5 cases na nag-positive, tapos na po ba? Or ito na po yun at 2 lang yung nag-positive ng variant first detected in India? Doc Thea?
I'll answer. Baka may sinasagot si Thea. Sige. These 2 individuals were part of those 5 positive individuals that were quarantined, isolated, coming from India, no, or passed through India from April 1 to April 30 before we had our restrictions.
Yusek, yung sequencing po nung mga nasa MV Athens, tapos na rin po ba?
Ira-run ngayon according to the Philippine Genome Center. They will run it today sa isang maliit na machine. So it will be faster. So maybe Director Saloma can tell us when we can have the results.
Dr. Saloma?
Can you please repeat the question? I was away.
Doc, when can we get the results of the genomic sequencing of those cases who turned positive from the MV Athens?
We have 2 options. Either we will include them in the 350 to be run, or we had a request last night na kung pwede iparan sila in the shortest possible time. So we are asking the team kung meron pa kaming kits na para sa 25. If sa 25, then by tomorrow or the next day, that should be 24 to 30 hours, may results na tayo. Pag sa 350, that would be another 4 days, no? Pero we are trying our best na dapat 24 hours lang we can get the results.
Thank you po, Dr. Cynthia. Clarify lang daw po, Director Thea, yung statement nyo kanina that that the 2 had no history of travel from India, but they passed through India, or they came from India po?
When we interviewed them kasi, their statement is they came from these Middle Eastern countries. We'll further clarify, but as of now, the information they stated is they had no travel history from India. We'll get back to our media partners on this.
Okay. For you, Sec Vergeire, or any of our TAG members, how will the presence of the variant found in India, aside from the other variants found earlier, affect the DOH or the IATF's recommendation for the next quarantine classification after May 14 po?
As our experts have said, no, the management would still be the same. No, it's still consistent with our existing protocols. Although we are strengthening or tightening our restrictions right now because we would like to prevent further spread of this kind of variants. So pag tinignan po natin yung parameters na ginagamit natin for community quarantine classification, ang atin pong measures for us to de-escalate would be the ADAR and the 2-week growth rate plus the gatekeeping indicator. So if in a specific place, we can see that there is increasing number of cases and there is this specific variant of concern, and that's part of the factors that we will be considering. Maybe our TAG experts also can provide their views, Dora.
Doc Edsel, go ahead po.
Yeah, I think this really underlines the fact that we have to protect our borders. Kasi, this is already, yet another variant. Buti na lang yung T1, yung galing sa Brazil, mukhang hindi naman nakikita natin na pumapasok and it hasn't spread in the community. But this is also why we advocated for the 10-day facility-based quarantine followed by the 4 days at home. Precisely because with these variants, the risk, especially if they're more transmissible, of an explosive outbreak is really there. And so aside from the border control measures, we also keep emphasizing na yung minimum health standards until we get to a level where mababa na talaga yung community transmission and mataas na talaga yung ating vaccination, these are still essential. I mean, as we see that the cases are going down, at least in NCR, the virus is still there. Naghihintay lang talaga yan. And now we also know that probably there are more variants circulating. Mas madali talagang mag-surge ulit. So from our standpoint, even doubling the efforts to keep the virus levels down, protect our borders much more stringently are really what are very important. Kasi the policies themselves that are there already are pretty much will control the virus. It's really making sure that these are that these are carried out more stringently is what will enable us to keep our economy open while keeping the virus levels low.
Thank you po, Doc Edsel. That's very clear. Just a clarification. So, 2 cohorts po, no? So, the MV Athens, yun yung may nag-positive na 2 cases undergoing genomic sequencing po yun. The other one is yung, tama ba, USEC, yung 155 passengers, 5 doon yung nag-positive, 2 yung nag-positive for the variant first detected in India. And we're also clarifying how they got the variant from first detected in India when they did not have travel history. USEC or Director Thea po?
Laura, may I clarify? So the MV Athens had 12 Filipino crew who tested positive on PCR. And when they arrived here, they have been isolated and others have been admitted. We reswabbed these 12. 11 turned positive again. At merong isa na kailangang i-rerun. At ito po, from the 11 na nag-positive, meron po tayong siyam na tinatawag nating eligible for sequencing. Kasi sapat yung sample size, mababa yung CP value. So yun yung isasama po doon sa ating sunod na run. Ito yung nabanggit ni Dr. Saloma. The others po, yung pong 5 from India na na-detect natin previously, I have just been informed, may isa pong nasama doon sa latest sequencing. At hindi po kasi VOC yung lumabas po sa kanya. It's another variant na lumabas. So hindi po sila kasama doon sa 2 na nag-positive po for the B1617. Yung other 4 po, we're checking if ano po yung lumabas sa sequencing po nila. We'll update our media partners on this. Thank you, Laura.
Thank you po. USEC, would you like to add po?
Yes, yun na, yung sinabi ni Thea, no? So initially we had 155. Everybody was tested on the 5th or the 6th day. And ang lumabas, 5 positive individuals and 2 nga yung na-sequence natin na merong Indian variant. As to the MV Athens, we will run the 9 samples based on Philippine Genome Center's existing or current na pwedeng i-run, no? Kung dun sa 300 plus sample or batch or doon tayo dun sa 25 na sample. So hopefully we can get the results before the end of the week. Laura?
Dr. Ana?
Laura, siguro I just like to pick up on several points that have been shared. I think beyond the fact na nakita natin or meron tayong announcement today na meron tayong variant of concern, I think one of the important takeaways from this is to realize that this finding actually supports kung bakit ganito yung policy na ginagawa natin ngayon for returning overseas Filipinos and overseas Filipino workers. Ito yung dahilan precisely kung bakit natin kinakailangan na magkaroon ng mas matagal-tagal na quarantine and delayed testing. Kasi nga, maaring hindi natin makita kaagad yung positive result pagkadating mismo nung traveler. Pangalawa, siguro yung punto na actually itong mga travelers na ito na identify natin even before the restriction happened. So katulad din ito nung una nating kaso ng variant na na-pick up, no? Yung sistema mismo gumalaw ng tama, kaya kahit na hindi pa natin nire-restrict yung travel galing sa bansang naturing, nakita na natin na meron pala tayong ganitong kasong nakapasok. So I think this should be reassuring also for the public na ang ating sistema basta nasusunod, magkakaroon tayo ng magandang proteksyon galing sa pagpasok ng mga variants from other countries. Yun lang, salamat.
Maraming salamat po, Dr. Ana. Question po on that note na sinabi natin na ito yung gamit po ng data natin no, on public health intervention. So yung question, Yusek Vergere, will we now recommend an extension of travel restrictions on these travelers from India and other countries with the B.1.617?
Well, this is part of the discussions with the IATF COVID-19 Variants Task Force. No? So isa po yan sa ating titignan base rin sa mga datos na naitatala natin ngayon if it has been affecting our case numbers, if it has been affecting the admissions, no? Kung tumataas ba uli po yung sa ospital and all. So that has to be discussed first and then we will inform everybody. But for now, we continue on with the restrictions until we can recommend to the IATF.
Salamat po, Yusek. Pong clarify ulit. Tama ba, Doc Thea, na yung isang nakitaan natin ay nag-positive sa ibang variant? Is the variant under investigation, a variant of concern, or just a mutation that we saw?
Just, it's a non-VOC or a non-VO and also a non-VOI po.
Okay, thank you po for that. Doc Thea, how were they, how were they included in the sequencing when they did not have travel history from India? How were they chosen to be sequenced?
Ang paghahanap or pamimili naman ng ating sequencing, una, kumukuha tayo from our incoming travelers. So whether they came from India or yung mga ating mga tag na countries, sinasama rin natin sila. So isa yung dahilan, kaya meron tayong mga nasama na other ROFs dito sa ginawa nating sequencing run. So even if they did not come from India, nasama. At yung nga pong dalawang nasama natin are other returning overseas Filipinos who came from these Middle Eastern countries, and they are the ones who tested positive for the B.1.617.
Salamat po. Clarification ulit from Ms. Aiko. Sorry po, asking again, kumusta ang status ng close contacts? Although sabi ninyo, Director Thea, naka-isolate and quarantine sila kaagad, so walang close contacts.
Yes, kasi 'di ba ang close contact naman, ito yung definition natin na nagkasalamuha tayo, 15 minutes, may direct exposure tayo. So since ang ating mga positive cases naman ay upon arrival na ilagay na natin sa ating quarantine facilities, at doon sa mga quarantine and isolation facilities natin, yung mga nag-aalaga naman sa kanila ay mga naka-full PPE. And by the time they were released from isolation or quarantine, tag na sila as recovered. Kaya wala tayong na-detect na mga close contacts among those upon their arrival here in the Philippines.
How about daw po yung mga nakatabi nila sa eroplano?
Okay. Meron tayong mga nakita mga pasahero no na nakasama nga po doon sa eroplano. Sila ngayon ay kinukumpleto natin yung datos no, pero yung ating data na available, ang mga naging passengers yun, kasama niya doon sa 4 rows, may mga nag-test negative na po no. So ang inaalam na lang natin ay kung tulad ng ating kaso ay nakakomplete na rin ba sila ng kanilang quarantine at kung sila ay naiwan ding asymptomatic and well up to this date. We'll give an update after we have completed or gathered that information.
Thank you po. Yusek, pwede bang pakiulit na lang, no? Yes, magbibigay kami ng list later, pero pakiulit na lang po ulit sino yung mga saan po nanggaling yung dalawang nag-positive sa COVID, sa variant first detected in India po. Doon po ba sa MV Athens, doon sa 155 passengers, doon po ba yun sa initial na 5 na ni-report natin?
The 2 who turned positive for these variants came from the 155N. No? So sila yung na-report natin na dumating sa ating bansa from April 1 to April 30 na ginather natin lahat. And we identified who among them turned positive. And dito sa ating 155 na to, 5 po ang nagpositibo dyan. Yung 5 nagpositibo po dyan, 2 po dyan dun sa 5 ay nag-positive sa Indian variant.
Salamat po, Yusek. Papadala na lang po kami ng listahan mamaya para malinaw. Last na lang, Director Thea, no? May gagawin pa bang contact tracing doon sa 2 positive sa variant first detected in India?
Sa tingin ko, the more appropriate term is, kasi kung contact tracing, ito yung maghahanap kung sino pa yung na-expose. Sa ngayon, mga nakakumpleto na to ng 14-day quarantine. It's more of verifying, validating if the other passengers, for example, yung katabi or kalapit ng ating case sa eroplano, ay i-verify natin kung naiwan nga po silang asymptomatic or sila po ay ano po yung laboratory status at kung sila po ay nakakompleto nga ng 14-day quarantine. Dahil nga yung contact tracing, wala naman na tayong nakitang close contacts after they have arrived here, put in a quarantine, and then finish their quarantine and isolation.
Thank you, Director Thea. With that, siguro tanungin ko na lang po either Dr. Edsel or any of our experts, no? Ano po bang implikasyon nito sa ordinaryong Pilipino ngayon na nakaka-detect tayo ng mga variants po, no? Either of interest or those of concern. Doc Edsel.
Yeah, I think ang implication talaga nito, itong ating pandemic, kaya nga pandemic ang tawag sa kanya dahil global importance po talaga ito. And what we do affects our neighbors and what they do affects us. And nakita naman natin, una, maganda naman yung performance ng India early in the pandemic. And then ngayon, nagka-problema talaga sila at doon pa lumabas yung latest variant of concern. So it's very important that we don't just look at what we're doing in our country. We also are mindful na what we do in our country has implications for the rest of the world. And that goes vice versa as well. So very important also that we have the tools to be able to detect these variants of concern na ginagawa nga ng Philippine Genome Center at ng UP NIH dahil meron nga tong implikasyon sa kung anong nakakapasok at kung kinakailangan pa ba natin magkaragdagang pag-iingat at yun nga we emphasize nga our minimum health standards, plus the final implication of this is yung effect on the vaccines. For now, mukhang okay naman yung epekto ng vaccine sa variants, especially for preventing severe disease, but ginagawa na rin ng mga vaccine companies yung pwedeng maging booster later on. So it's very important na alam natin kung ano yung circulating variants dahil yung magiging later choice of vaccine boosters, may implications rin po talaga ito. So I think that we need to continue doing our biosurveillance. We need to think about how it will guide our responses and more importantly, how we can change or adjust our policies para mas maganda yung ating control ng COVID-19 at matapos na rin itong ating pandemic as soon as possible.
Maraming salamat, Dr. Edsel. Before I ask our experts for their key reminders for us, Yusek, is it okay if you be asked about vaccine-related questions?
Okay, sige.
Yusek, so it's about the Pfizer and not on the variants. In real-world trials, is Pfizer the most effective? Is there data about other vaccines? Is there also information regarding the schedule of the delivery of other Pfizer vaccine supply? Is there info regarding schedule of delivery of vaccines ordered by private companies? Thank you. And then the other question for COVID vaccine will be, ano daw po ba ang reported expiration of the ano po bang reaction nyo, Yusek, on the reported expiration of AstraZeneca shots sa June and sa July?
Okay, this seems a handful, ang dami, no? Unahin ko yung AstraZeneca, yun ang natandaan ko. Ang AstraZeneca vaccines, ito po ay napagbigay information naman sa amin, no, that this has expiring dates of June and July. 1.5 would be on June and the rest would be on July. Ngayon, kailangan din maintindihan na ating mga kababayan, lahat po ng bakuna na po-produce ngayon, no, and available, ang pinakamatagal na po na expiring date niyan ay 6 months. So meron pa ho tayong mga transaction and transport for these vaccines. Kaya minsan pag dumating sa isang bansa, ganito na po yung time for expiry. Pero ang sinasabi natin sa mga kababayan natin, wala po tayong dapat ikabahala. Nakagawa na po ng mekanismo ang ating vaccine cluster on how we can be able to consume this vaccine. We will be giving these vaccines as first dose because WHO has committed that they will be providing additional AstraZeneca vaccines by the end of May or the first week of June. So hindi po natin dapat ikabahala na meron po tayong ganitong expiring expiry date for the vaccines. Almost all or all vaccines ngayon wala pong mahahabang expiry dates talaga para sa kanila. The second question as to where the Pfizer vaccines will be allocated, we received 193,000 Pfizer vaccines last night. And ito po ay i-distribute na ngayong araw sa NCR. Sa NCR po, ang mga pagbibigyan, yun pong mga atin mga lungsod na meron po silang ultra-low freezers. Meron pong mga lungsod sa Metro Manila na meron sariling kakayanan. They were able to set up their ultra-low freezers for this requirement. Pero meron din naman pong ibang mga local governments natin, they contracted a third-party logistics para mag-store at saka mag-distribute para sa kanila. So ito po mga LGUs natin sa Metro Manila ay mabibigyan itong Pfizer vaccines. Aside from that, we are also going to provide Region 2 and that is Quirino because they were also able to establish an ultra-low freezer na dun sa kanila na facility care of a third-party logistics provider. Also, we will be giving to Cebu and to Davao because they also have that capacity. As to the efficacy and the effectiveness of Pfizer vaccines, may I ask maybe Dr. Isa or the other TAG members to answer this question for us, please. Dora.
Regarding the real-world effectiveness of the vaccines, it's not just Pfizer that has been shown to be effective in the real world or in settings where there is a variant. Aside from Pfizer, there are also studies that have shown that Moderna, so the two mRNA vaccines are effective in the real world. Then there's also studies on the Novavax vaccine has been shown to be effective also against the B1.1.7 variant. So thank you, Laura.
Thank you po.
Also,
Dr. Isa.
Sputnik pa rin, also Sputnik, has also been shown to be effective. So Pfizer, Moderna, Sputnik, Novavax, we have data that they are effective against the UK variant.
Thank you po,
Dagdag ko
Dr.
lang,
Go ahead po.
dagdag ko lang, Laura. Actually, there is also some real-world data from Brazil that Sinovac works against the Brazil variant, and also some real-world effectiveness data from Chile, which included 10 million people na nabigyan talaga ng Sinovac, and the efficacy rate against severe was about 85%. So we're gathering more and more of this. Also, I think the Astra data is coming in as well.
Yes, go ahead po, Dr. Ana.
Laura, siguro what I'd like to add to this discussion is if we look at countries where the vaccination programs have started to roll out, we do see the slowdown in terms of the number of cases, number of hospitalizations, and this actually provides additional information that vaccines are able to contain transmission of COVID. And so this will be equally valuable in sources of information to prove that the vaccines work. Thank you.
Thank you po. Yusek, would you like to clarify regarding the ones that we've sequenced?
Yeah, our apologies. We just verified the samples sent to the Philippine Genome Center. So ito na po yung verified data natin. Again, our apologies. Indeed, there were 155 incoming passengers who passed through India or stayed in India for the past 14 days, and 5 of them turned positive. For among those 5 positive, 1 has been sequenced and was positive for the A lineage. 1 was for sequencing, and the 3 were not eligible for sequencing because of CT values of greater than 30. Again, I will repeat, 155 travelers coming from India or passed through India, 5 were positive. The 5 were subjected for genome sequencing supposedly, but only 1 was sequenced for this run, and it has an A lineage. It is not a variant of concern nor a variant under investigation. The other 1 is set for sequencing pa lang, makakasama dito sa next run natin. Yung 3 dun sa 5, hindi po siya nakasama dun sa sequencing because their CT values were greater than 30 already. Now, for these 46 samples that were sequenced, there were 2 incoming returning overseas Filipinos that were included. And 1 came from Oman and the other came from UAE. UAE ba? Dubai, no? UAE, I'm sorry. So itong 2 to nakasama, sila po yung nag-positive, no? So no history of travel to India, or they did not come from India nor pass through India. They were part of the sequencing because they were the part of this batch that we sequenced for the returning overseas Filipinos. So ito po yung clear natin and verified data as of now. Again, our apologies.
Thank you po, Yusek. Last na lang po, maybe our experts have recommendation, no? Ano daw stand ng DOH or our experts kung mag-extend ng travel ban sa India and other countries na mayroong B.1.617? Doc, kayo ba sasagot, Yusek? Mag-extend yun ba? Or pag-uusapan pa lang natin?
No, maybe our experts would like to give their expert opinion, not as part of the COVID-19 variants task force. Maybe Dr. Edsel?
Yes, ma'am, can you repeat the question? Nag-cut out yung audio ko eh. Just as
Dr. Edsel,
yeah.
in your expert opinion, will you recommend the extension of the travel restriction for travelers with history of travel from India and other countries with the B.1.617?
Yeah, I think we need to talk about that because the big thing about what we've done already is that we've extended the facility-based quarantine to 10 days. And with 7th-day testing, I think we might be able to catch most of those people. However, I think this is an evolving situation. And we understand rin nga naman na the restricting movement in general has major implications on people from financial to obviously even mental. Minsan talaga it's been a very difficult pandemic. I think that I'm confident na the changes that we made to our quarantine policies are going to help us decrease the number na makakalusot. And so from that standpoint, I think that's an important mitigating factor. We can't keep them out forever. And so if there is an extension, hopefully it's not a long extension either, as long as we can show that we can keep our case numbers low.
Dr. Celia or Dr. Yes po, go ahead.
I was just thinking, madaling sumagot ng syempre i-extend yung quarantine, di ba? Pero I guess kaya we're taking our time to reflect on this kasi nga ang daming implications. And adding siguro or supporting what Edsel said about the current system, having been able to pick this up, I think it's really very encouraging. And siguro kung ma-assure natin yung compliance with the current testing regimen and with the quarantine protocols, maaring pwedeng as is muna tayo kung mahihirapan talagang mag-impose ng ban. So the current system seems to be a viable option. if we cannot impose a ban. But of course, it's always simpler kung sasabihin mo ban, kaya wala nang masyadong iniisip pa lahat ng mga humaharap doon sa mga ports of entry. So I think yung advantage lang is meron tayong other workable solutions. Thank you.
Thank you, Doc Ana. Siguro tanong ko na lang din, may implication ba ito sa response natin ngayong VOC na rin ang B.1.617.2 variant per WHO?
Yeah, I mean, I think that's, we were already treating it that way. So I think, but yeah, Ma'am Isa also has something to say. Sorry.
Yeah, it's all right. No, I think as what's mentioned, the measures will still remain the same. No? It just underscores the fact that we really need to continue intensified implementation of our border control measures, yung testing at the right time, and then completion of quarantine. And it's not just implementation, but also unified implementation, across all our regions. So sana, cooperation din from our LGUs, yung pag-hand-off din, yung quality of implementation kasi is very important. Yung, like in relation to the question then earlier on whether we are going to extend the travel ban or not. I agree with Ana, that kasi if we are able to really implement this border control measures quality-wise and pare-pareho tayo na susunod dun sa policies that we have recommended, then I think we will be able to eventually, hopefully, and I'm hopeful that we will be able to weather this surge. Kasi siguro, just ito na yung message ko, the virus and the variants do not respect borders. And we've really seen already that it's mobility and travel that facilitates the spread of the virus. And the surge naman is because of the high transmissibility brought about by the mutations. And we've seen when we drop down or when we relax our measures, that's when the surge comes in relief. Kaya multifactorial yung surge. The variant, which is highly transmissible, and then you relax in your measures, then that's when we have the surge. So kaya we still need really to implement, practice our personal protective measures, apat dapat, plus magpa-vaccinate tayo. When our turn comes to be vaccinated, go for the vaccine. Kasi the trials on the vaccine consistently show that it is efficacious. It's efficacious and effective in the real world. Wala pang drug na tayong napuprove na effective in preventing symptomatic infection or an effective prophylaxis. It's still the vaccines, Maganda yung mga trials ng vaccines. It's done on big populations and it has been shown to be efficacious and effective in trials. Really complement the once we are able to vaccinate enough, then we will be able to contain it.
Thank you so much, Dr. Isa. So to summarize, when we talk of our genomic data, it really guides population-level interventions, meaning it tells us how widespread should the lockdown be. It tells us also, it guides us how short or how long our travel bans will be, But at the individual level, it doesn't affect or wala po siyang implication as it relates to our case management. So whether it's highly transmissible or not, it's the same thing, MPHS and vaccines pa rin po. in increased severity, it's the same case management because it's the same symptomatology po. And then in terms of it being immune escape, our experts have repeatedly said that the vaccines remain to be effective against the severe form of COVID-19 vaccines, severe form of COVID-19 infection. On that note po, I will ask our experts to give their final message, beginning with Director Jimmy Montoya. Doc? Sige po. Kay Director Celia Carlos po.
Good
Go
morning.
ahead. Good morning, ma'am.
Based on the discussions which were heard earlier, we now really appreciate that the whole world is one big community when it comes to infectious diseases, because these diseases do not respect borders. In fact, viruses are shared freely among countries. And we see that countries who have been successful in controlling occurrence of surges are countries who implement strict minimum public health standards. Some of them days. So, can I be heard?
Yes,
Yes
Doctor,
po.
go ahead.
So, even if our cases are going down, we should not be complacent because we are seeing the appearance of the new variants of concern, and we do not know what else may appear in the future as long as this infection remains uncontrolled. As we have seen in other countries, many of them experience plateaus, but these plateaus were followed by surges when new mutants appeared. So the country is trying to improve its response in terms of biosurveillance, with the objective of getting more population-based information on the extent of the distribution of these variants of concern. Since the more accurate information is, the better the control measures will be. So let us all remain vigilant and comply with the recommendations so that we keep on controlling this pandemic, at least within the Philippines. Thank you.
Thank you, Director Celia. Dr. John Wong po, and maybe you can also include in your final message if mayroon na bang projection on the transmissibility of the B.1.617.2. Dr. John?
Thank you, Laura. Yeah, so the way we should be looking at the variants is this is a threat to public health. No? So we need to do the things we set out to do at the beginning of the pandemic, but do them better. So we need more testing to identify those who are sick. We need to trace their close contacts, and we also need to ensure that people are isolated and quarantined for the appropriate time. Sorry, Laura, what was your other question?
The question po is, mayroon po ba tayong estimation or data on the transmissibility of the B.1.617.2?
There's the UK has just classified it as a variant of concern, and they said that there's increased transmissibility, but I haven't seen that study yet. I don't know whether they have exact numbers for that. And I think last night the WHO also classified it as a variant of concern, because of transmissibility. But we'll try to get a copy of those studies first. Thank you.
Thank you, Dr. Wong. Director Eva Cutiongco de la Paz.
Magandang tanghali po sa inyo lahat. Thank you, Miss Laura. Ang ating pong kaalaman na ngayon nananatili pa rin. Ang bakuna po ay gumagana. Ang pagtest sa virus gumagana. Ang mga paggamot nito gumagana at pareho pa rin. Ang bakuna ay makakatulong pa rin pong mag-control ng mga variants at pag-iwas sa matinding karamdaman. Maaring may mga ilang variants po na sinasabing matatakasan ang mga bakuna, pero siya pa rin po ang ating pangunahing panangga. Ang importante pa rin ay kunin natin ang unang bakuna na inaalok sa atin. Huwag na mag-alinlangan at maghintay sa perpektong bakuna kasi baka wala naman pong ganun, no? So hinihikayat po ang mga bansa na palakasin ang mga kakayahang gumawa ng genomic surveillance upang makapagbigay ng isang kinatawan na indikasyon ng lawak ng distribution ng mga variants batay po sa local na konteksto. At upang makita ang mga hindi pangkaraniwang kaganapan tulad po ng mga clustering of cases or surge, spikes, no? At syempre po ay pagpasok ng mga variants from international travelers. Ang pinakamahalagang mensahe ay kung mapapanatili po natin ang bilang ng mga kaso na mababa sa pamamagitan ng pagiging responsable at paggawa ng ating bahagi sa pagsunod ng mga pamantayan, yung ating pong minimum public health standards, ay mapapanatili po nating ligtas at tayong lahat. Maraming salamat po. And thank you, Ms. Laura.
Thank you po, Dr. Eva. Director Cynthia Saloma.
So hello everyone. If the cases in India is an indication, I think it's a lesson for everybody not to celebrate too early about successes in terms of the management of COVID-19. This has always been an evolving process, so it's really, really important for everyone to continue to maintain the public health standards that we have to do. So there will be cases where we will be able to control infections. And then it's really like a wave. On one hand, you will have a plateau. On the other hand, again, another spike. And most of these are really associated, of course, with complacency, increased mobility. And of course, side by side with this is the emergence of variants, which may just be silently waiting for the opportunity to become causes of super spreading events. So it is really, really important for everyone to get the opportunity. If the opportunity arises that you get vaccinated, grab it. And at the same time, also that we should not forget to exercise the minimum health standards. On the genomic biosurveillance side, we were able to detect these cases, apparently not even from travelers in India, but from travelers from other countries. And that tells you also that the spread slowly has been going on in countries where some of our returning overseas Filipinos have come from. So, but for as long as our quarantine measures are in place, and I think we have been refining our protocols, so these will also ensure our public and the families of our returning overseas Filipinos that they will not be unnecessarily harmed, because by the time they really are released from the quarantine centers, we know that they're already non-infectious. So for everyone, be careful. Please do not forget to exercise and to practice the minimum health standards and get vaccinated. Thank you.
Thank you po. Dr. Edsel Salvania.
So, ano lang naman, maikli lang naman po yung sasabihin ko. Pangatlong surge na po natin to. Hopefully, huli na tong surge natin. Pero ito na naman, may variant of concern na naman. We know what works. So I think that what's really important is that hindi tayo magsawa at dapat po talaga vigilant tayo with these new variants. And we know how the virus gets transmitted naman eh. So as long as we stick to the guidelines, listen to the experts, stop sharing fake news na nakakapagpanik sa ibang tao, I think we'll be okay, especially now that the vaccines are here. Thank you.
Dr. Isa Alejandria.
Okay, thank you, Laura, and thank you to our media partners. The message is the virus is our enemy. So we have to focus our efforts on the virus. And as we've heard, virus does not respect borders, so it can virally spread. Kaya we've really seen through the surges, no? And we've learned our lessons, and we should not let our guard down. Okay. So it's still the personal the minimum public health standards. And now we have to be thankful to science that we have the vaccines. No, after years of research, in this pandemic, we are able to have this additional weapon, no, against the virus. So the message to the public is really get vaccinated. Let's not be distracted by other drugs, supplements that are being sold or yung minamarket sa atin, no? Let's not be distracted by that. Stick to science, no? What has been proven. So let's work on that. And genomic surveillance, on the other hand, keeps us on our toes, no? It guides our policies. On an individual level, it probably does not really help, no, in the case management, no, it's still the same. But it keeps us on our toes and provides us data on whether the variant is in the country already. And it also provides basis for us to continue our intensified implementation of border control. Kasi nga, we've seen that it's mobility and travel that allows this virus and variants to spread. No? So as we continue to have more cases, the virus will evolve as part of its survival. Diba? So kaya, again, minimum public health standards and vaccines will hope, and I'm hopeful that we will be able to reach that goal of controlling this pandemic. Thank you.
Thank you po. And Dr. Ana? Sige po. I think for that, we'll ask you, Sec Vergeire, for her final message to today's special press.
Laura, sorry.
Ay, go ahead po, Dr. Ana. Sorry.
Okay, sorry. Oo. So, I think yung nabago ngayon sa current surge is that we've had more clusters in households. Kahit naman hindi natin tignan yung statistics, mismo sa personal experience natin, marami tayong mga kakilala na pamilya yung apektado. So, in addition to what has been shared, siguro isang paalala lang para sa lahat ng mga individuals na natetest na mag-positive or kaya may nararamdaman, huwag na nilang ipagpaliban pa yung pagtetest at pag-isolate habang inaantay nila yung kanilang test result. Ito kasi yung isang paraan para mapigilan natin yung mabilis na pagkalat ng sakit, not only within our households but also in the communities. So kung ang dati nating ugali ay pinapakiramdaman muna natin ng sakit bago tayo magpa-test, ngayon siguro mas maigi kung may nararamdaman na tayo na mag-isolate na kaagad, maghanap ng paraan na magpa-test para sa lalong madaling panahon, alam na natin kung tayo ba ay positive for COVID or ibang sakit ang ating problema. With that, no, maiiwasan nating mahawaan yung ating mga kasama sa bahay and also yung mga nakakatrabaho natin at ang larger community as well. Thank you.
Maraming salamat po, Dr. Ana. And you, Sec Vergeire, for your final message.
Yes, maraming salamat po. First, I would like to thank all of our experts included in our IATF COVID-19 Variants Task Force. Maraming salamat po for your continued guidance and support. Pangalawa, we'd like to thank Director Thea and Laura for this special press con. So, narinig na po natin lahat ng sinabi ng ating mga eksperto, hindi ko na po ulitin. Gusto ko lang hong ipaalala sa ating mga kababayan na ang virus po, hindi siya mag-mutate kung mababa ang kaso. So magtutuloy-tuloy po ang paglaganap ng mga variants kung hindi po natin masusugpo ang pagtaas ng mga kaso sa ating bansa. So sana po tulong-tulong tayo. Minimum public health standards plus vaccines will give us that sense, no, na maari na po tayo makabalik dun sa sinasabi nating or makapunta dun sa new normal na inaasahan natin lahat in the future. So sana po tayo po ay manatiling mag-comply sa minimum public health standards. Atin pong alalahanin na yun pong ating pagpoprotekta sa ating sarili ay napoprotektahan din po natin ang ating kapamilya at ang ating komunidad. So magtulong-tulong po tayo lahat at maraming salamat po sa inyo.
Magandang hapon po sa inyong lahat and see you tomorrow or Friday. Thank you.
Thank you very much. Good afternoon.